In today's video, we're going over how to introduce and advance agility exercises in your patients after major injury or surgery. What's up guys, this is Dan from Fitness Pain Free. I'm a physical therapist and a coach. We have helped to make thousands of incredible coaches and clinicians through our online courses, mentoring programs, and communities. The goal of today's video is to make you 1% better. You got a patient, let's say post-op ACL reconstruction, you're doing the return to run program, but they want to get back to a change of direction sport, something like soccer. What do? Well, of course, we need to be able to introduce and prescribe agility exercises and change in direction exercises so you can safely return to sport over the course of time. The other thing to keep in mind is a lot of these folks are getting hurt while they're changing direction. So think about ACL injury. Those folks are pivoting, planting that foot, changing direction, and they can injure their ACL there. So when we are introducing agility exercises, this is important for returning to sport, obviously, but also helping to reduce re-injury rate if we do these appropriately. All right, just like in introducing any other form of plyometric, we want to first achieve a quiet knee for our patients, or quiet hip, quiet ankle, whatever that is. So largely we need full range of motion at that joint. We're also making sure that there's minimal to no swelling and minimal to no pain. And as we introduce these exercises and advance them over the course of time, we want to make sure that knee or that hip is not getting more stiff, not getting more swollen, getting more painful, all right? So introduce these, we need to make sure that the knee is quiet, or the hip is quiet, knee is quiet, and over the course of time it stays quiet when we introduce and advance. All right, the next point is that we need to make sure that we have good symmetry between sides before we start introducing agility exercises. They may be around 70 to 80%. So basically, the surgical side leg has 70 to 80% of the strength of the involved side leg. We can also look at torque. So for women, maybe you want to see around 1.7, 1.8. For men, maybe you want to see a little closer to that 2.5 before we start these drills. Okay, so most rehab protocols are going to start off by strengthening in the sagittal plane. The thing about agility is that it takes place in the frontal plane and the transverse plane, right? So when we're beginning our agility program, I like to start with a little strengthening in the frontal plane. And I do this through a few different exercises, the first of which is going to be a lateral lunge. So Jacob's going to take this weight here, bring it in goblet position, go ahead and lunge to the side. Let's do 2 reps, pushing back to the start. Excellent. I also like to use a lateral deadlift, kind of the same idea, but you're holding the kettlebell down low. Go ahead and take a step to the side and come right back. Right? So we're building a little bit of competency in the frontal plane with strength. We can start to advance with speed and move a little more quickly. I also like to utilize a bunch of different lateral sled drag variations, the first of which being a lateral shuffle. So essentially, Jacob's going to take all the slack out of this strap here. He's going to drive with that leg that's closest to me. Let's do 2 or 3 steps. Awesome work. I also like a lateral sled drag. So essentially, we're going to have Jacob facing this way, moving that way. Go ahead and show me that. Piece of cake. Great job, Jacob. And we start off our plyos with a little bit of pogo jumping, but we do these outside of that sagittal plane, right? And in the sagittal plane a little bit. So first, regular pogo jump. Yep, now this is scissors, so splitting those feet. Very good. Next one, go wide out, feet out wide. Good. Let's do a mogul jump, feet together. Excellent. We'll go forward and backwards. We're really just working in multiple planes of motions here. Next, we have a dynamic warm-up. We use a variety of different drills. The first of which is going to be a tall shuffle. Jacob, show me that. Excellent. Yep, go into the cone. Come right back. Very good. Nice and easy. The next one is going to be a low shuffle. So getting a little lower. Yep, making your way down. Cutting. Come right back. Excellent. Good job. Next will be a tall karaoke. Karaoke, I know what you say. Very good. Change your direction. Come right back. Awesome. Next one is a low karaoke. Yep, down and back. Looking great. Good. Head and back on me. Awesome. And the last one is a lateral skip. Yep, every time you skip, really driving yourself to the side. Same thing coming back. Go for it. Yep, push, push. Great. Next, I like to use some ladder drills. The first one we'll do are lateral cuts from the outside of the ladder. So Jacob, go ahead through. Cut, 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 and then back to the start. And one of the things you'll notice that Jacob is doing is he has a little intent. He's not just moving in and out of the ladder back and forth. He's trying to push off the ground and cut the opposite direction. Let's go one more of those just so people can see that. So see how he's pushing himself to the side. Basically wants to prepare himself for changing direction and cutting. So he's doing that with the ladder. The next one we'll do are cuts from the outside of the ladder, but going forwards and backwards. We use the backside leg to go in and out, although sometimes the front works as well. You mind showing the viewers this one here, Jacob? Good. Yep. Back, forward, back, forward, back, forward, back, forward. Yep. And as you can see, if you have an athlete that's got to be able to run forward, change directions, go backwards, and then go from backwards to forwards, we're preparing athletes to do that, but it's very low levels of force because they're not running yet. Next, we have some icky shuffle progressions. I have 3 that I really like to use with my athletes. A couple key points here is that Jacob is trying to keep his weight over top the ladder. When he's changing direction, he's trying his best not to sway side to side, all right? Let's do the first icky shuffle here. Yep, out. Yep, very good. There you are. Yep, 2 and 1 out, 2 and 1 out, 2 and 1 out. Very, very good. Yep, and as you can see, Jacob's trying to keep his weight over top the ladder the entire time. He's trying his best not to sway, right? Let's do the second variation. These are 2 feet cuts on the outside of the ladder. So 2 in, 2 out, cut, 2 in, 2 out, cut, very good. Yep, and as you can see, Jacob is staying, his center of mass, center of his body is right over top of the ladder every time he cuts. If you wanna make this a little more challenging, I'll actually have my athletes cut out a little further. So as opposed to just taking 1 foot slightly outside the ladder, you can go a little further, have a little bit more aggressive cut as you go, right? Let's use the third variation, which is a crossover step. So go ahead, Jacob, crossover, 2 out, crossover, 2 out, very good, yep. And as you can see, Jacob's doing a good job keeping his weight over top of the ladder. His change in direction is very crisp. Next, I like frequency drills. Another way that you can introduce some of these forces without moving too quickly and flaring up your patient. So the first one we'll do is a frequency drill over a line. And essentially, Jacob's gonna start bouncing up and down. He's gonna start darting his outside leg over the line back and forth. Go ahead, take a breather. And usually prescribe this for sets of 3 to 5 seconds, nice and quick. You wanna give us a go? I'll count you down and then count you down again. 3, 2, 1, go. 5, 4, 3, 2, 1. Resting, very good. So getting your athletes moving, get your heart rate up too, which is another good part of these. We'll also try a frequency drill facing forward, and we'll go forward and backwards, right? So again, it's just one leg, but the idea is, let's use this one just so people can see. Shooting that right leg forward, back and forth. I'll count you down. 3, 2, 1, go. 5, 4, 3, 2, 1, resting. So again, we're kind of working the forward and backwards pattern, side to side pattern, introducing a little bit more speed. The last thing we can do is we can do a hip switch, and this is kind of working a little bit more in the transverse plane. Let's have you face, right, straight ahead so people can see. And let's do it slow at first. So let's have you switch your hips so that you have your hips facing the corner here. Yep, so basically your pelvis is facing the corner this way, and we'll switch back and we'll have your pelvis facing the opposite corner, right? Yep, and keep your feet a little bit more narrow, trying to go too wide when you're doing this. And when I give you a 3, 2, 1, go command, we'll just go back and forth nice and quick. 3, 2, 1, go. Good. 5, 4, 3, 2, 1, rest. So again, you can see how we're kind of working all these different planes a little bit more quickly now. I also love low box drills. So we're gonna start with a cutting drill here. So Jacob starts with his weight centered over top of this box here. One of the reasons why I really like the box is because athletes can visually see, all right, I need to have my weight over top of the box. He's gonna cut and switch to the other side. Good. And he went back. Let's go ahead and do a few back and forth. Good. The other thing that Jacob's doing a really good job of is when he has his left leg forward, his right arm is forward. And when he switches, his arm switches as well. Because we want to create power from the upper body as well as the lower body, right? The other thing that you will see for athletes after they've had, let's say, a major surgery like ACL reconstruction, is that when they go side to side, they might not load the knee very well or the hip, depending on the surgery that you just had. So show me a very stiff knee on this side, right? And then switch and then bend a little bit deeper. So you can see that Jacob on this side, he's bending the knee more, he's more comfortable on this side. Let's say this is the surgical side knee, go ahead and switch again. You may notice that you land a little stiffer. I think Jacob's, he's kind of like exaggerating right here, but you will see this, and it's good to pick this up during low level agility drills, because as soon as they go to higher level drills, like a shuffling drill, right, or blaze pods, or whatever else it is, you're gonna see this as well, and it's hard to change it when there's a more dynamic motion. So clean up the problems that you see at these low-level drills, like the ladders, as well as the low box, and then you can progress towards higher level activities over the course of time. So with the low box, you can do all the same icky shuffle drills that you did in a ladder. So if you're looking for a little variety in your rehab, you can go for it. Let's do that first icky variation, the classic one that everyone knows. Yep, very good. Yep, let's switch it up. Let's go 2 feet out. Good, 2 feet out cuts. Yep, 2 feet out cuts, 2 feet out cuts. Good, and lastly, we'll do the crossover. See how I do with that one. Nice. There you go. Perfect. Good job, Jacob. Next, we're gonna go to some shuffling drills. Essentially, we just have 2 cones. If you wanna make this drill easier, bring the cones a little bit closer. If you wanna make the drill a little harder, bring the cones a little further apart. The reason being is that if you have more space between the cones, within reason, athletes pick up more speed and have to decelerate with more speed, right? So start the cones nice and close, and over the course of time, we can make them a little bit wider. the first drill we'll do is shuffle, and then we're stopping right here, all right? So Jacob, go ahead and show me that. Shuffle, 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 and then stop. So Jacob's doing a good job with this technique right here. We're basically reproducing those same positions that we've been doing on the low box as well as the ladder. So as you can see, Jacob's got his weight on this inside leg right through here. He's got good alignment, so basically his knee is lined up over his toe on both sides, which is really, really good. His arms are in a good position, so essentially he's got this arm forward, this leg forward, right? So he's a great position to pick up and go the opposite direction. Let's walk back to the start. Let's do the same drill, but this time, go ahead and change direction. So stick that position, come right back out of it to the start, and go. Good, stick and go. There you are, great. So basically Jacob ended up running, but you can shuffle straight back to the start, right? We're gonna go over some other run variations in a minute so you can see all the different variations we try. This next drill, let's go back and forth twice, all shuffling, right? So go for it. Shuffle, 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 cut. There you go, shuffle, cut. Good, shuffle, shuffle, cut. Good, great job. So as you can see, Jacob's doing a phenomenal job here. As he approaches the cone, he gets lower and lower. When you have to change direction, you have to get low enough in order to change direction. If you're running really, really fast, moving fast, you have to get even lower. If you're not running that fast, you can stay a little bit higher, right? And obviously when you change directions, weights over the inside leg. I tell my athletes that when you land, you want to be as powerful as possible in your positioning to move whatever direction you want to go to next. All right, next we'll talk about a forward run to backpedaling. And I think one of the important things here, and it's good that we try to approach it with their athletes, is because if you have an athlete that compensates, that doesn't like to stop with the surgical leg, they may never do it unless you cue them to do that, right? So let's say that the surgical leg for Jacob is going to be his left leg. So when he runs forward, when he stops, I want him to stop with the left leg forward, right? And there's a few ways you can stop. So you can stop straight ahead this way, which is a little bit more intensive on the knee. So post-op ACL reconstruction, if you have a painful knee or a weak quad, you might not have your athletes do this because it hurts. They may decide to do a T-step. I think it's probably good, we were just discussing this, that you get athletes able to handle both types of change of direction. So essentially running forward, stopping this way and pushing back, as well as running forward and stopping this way. Because they're both gonna be used in a sport most likely. And on the way back, as Jacob's going back, he's gonna change direction with his left leg back this way, right? So this makes sure we don't have Jacob compensate through all of these drills, okay? So let's do one rep where you run forward, change directions, go back to the start, and go. Run, run, run. Good, and then right back. Excellent, good. And you finished off really well with that backside leg. And here's the thing, I tell athletes not to worry too much about the cones, because if their step count is not right, then sometimes they end up doing a weird step just because they're trying to stop before the cone. So largely we just want good movement mechanics. The cones are there as an idea of when to start and stop. So next set, what we can do, now I want you to stop with your right side leg forward and right side leg back. You ready? Go for it. Good, forward and back. Excellent, very good. So this next rep, let's go 2 times back and forth. Let's go all left side leg this time. You ready? Go for it. Good, good. And back. Awesome, great job. So we can make this drill more challenging just by doing more repetitions, obviously. We can also make it more challenging by putting some more space between the cones. And just like with the shuffling, when we change direction, you're moving very, very fast. As you approach that cone, you probably need to get lower, lower, lower. If you're moving very slowly, you can stay a little bit taller. The last one we're gonna go over is going to be a lateral run. So what's the difference between a shuffle and a lateral run? So largely, if the action is coming from one side of the field, and it's moving this way, and you need to be able to watch the action, but go to where it's going towards, you might either shuffle or you might run, right? Thing is, if you're in a court sport and you have very little space around you and you want maximum coverage, you may shuffle. But as soon as that person starts moving so fast you can't catch them anymore, you're gonna start running, okay? So if you're playing basketball, you may need more shuffling. If you're playing soccer, more lateral running, okay? So first, this drill, we'll do the same one as we did with the shuffle. So essentially we're gonna have Jacob run and then change directions here, but freeze, right, as you're changing. Ready? Go ahead and run, yep, facing ahead, and freeze. And the change in direction mechanics are very similar. Yep, you did it, good job. So essentially, you gotta have the weight on the inside leg here, right? And then from here, yep, this arm is gonna be opposite of here. And then when you run back, you're facing this direction, and all you do is run back to the start, right? So go ahead and run back. Good. This second rep, let's run there and back, no pause, okay? We'll take a look at your mechanics. 3, 2, 1, go. Good, and back. So I actually think it looks a lot better when we don't cue Jacob, we just make the drill a little bit harder. One of the things you'll find a lot with athletes, if you're trying to break down every single thing, when they're doing very low level exercises, it might be more frustrating than just telling them to move a little bit faster, and sometimes it just happens naturally, all right? So again, these cues, these components are very important. If you're having a hard time cueing them for higher level exercises, go back to the box, go back to the ladder. But I also find is as you increase the speed, as you make athletes move faster, they'll naturally do these things fairly well. And one of the ways I like to advance these shuttles, obviously like we said, we can put a little more space between the cones. We can also do a shuttle drill with multiple cones. I call this an advancing shuttle drill, and he's gonna be running forward and then back pedaling. So essentially it goes forward 2 cones and back 1, back and forth. I'm gonna have Jacob show, so it makes a little more sense. So Jacob, go ahead and show me a crossover run here. Running 2 cones, cut, 1 back. Good, 2 cones forward, 1 back. A little too far, that's okay, and run it through, yeah. But it's hard for you to see from this angle, but essentially we're looking for those same exact change of direction mechanics that we showed in the ladder, low box drills, shuffling drills side to side. And if you don't pick it up during the lower level drills, it's gonna be pretty tough to correct during these higher level drills. So if you have an athlete that's having a hard time during a drill like this, maybe in between sets of these shuttles, do some low box drills, work those positions, and go back to the higher level movement afterwards. And one of the last things we can do with our athletes is add a neurocognitive demand. There's a million ways to do this. I'm gonna make a video on this at some point, so stay tuned. The drill we're gonna use today is I'm gonna be pointing towards the cone, and essentially Jacob has to make the decision of where to go based on where I'm pointing. And the other piece is that he has to look at me the entire time, which is pretty relevant to sport, because oftentimes in sport, you're moving in one direction, but you have to change directions because the action changes going somewhere else. So you're reacting to the game time situation. You're not really thinking about your legs, your joint position, so on and so forth. So it is very important you get your mechanics down first before we introduce these, right? So essentially, we're gonna have Jacob standing right here, and I'm gonna give him a point, either to the left, right, his right, or to my right or his left, right? My second cue is gonna be thumbs towards me, which essentially means come back to me, and I'm gonna give him another cue of going either direction, either left to the right again, all right? Ready to give this a shot? Okay, so I'll get down here so you can see what's happening. Start here. Good. 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 And done. All right, so you can see how Jacob here is reacting to my pointing back and forth, side to side. Another cool drill to try with your patients. And over the course of time, the idea is to make these sport-specific drills specific to the actual sport you want to get back to. So basketball players might be doing more shuffling, soccer players might be doing more sprinting. You can also look at GPS data on PubMed, looking at how much running an individual athlete does in a sport. Let's say you're a soccer player at a professional level, you're doing somewhere between 5 to 8 miles worth of running. You can also look at work to rest ratios. So some of these folks are gonna be doing, let's say, 10 to 15 second sprints, followed by 30 seconds of jogging. You can reproduce that in the gym. So as much as possible, we're trying to recreate the demands of the sport the athlete is trying to get back to over the course of time.